It's been exactly 1 month since the death of George Floyd in Minneapolis on May 25th. Earlier this month, I pledged that I would, 1, review the police use of force policies in the city of Merced. 2, engage our community by including a diverse range of input, experiences, and stories in the review. 3rd, report the findings of the review to the community and seek feedback. And 4th, work to reform our police use of force policies based on findings. Today's an important step in that process. Councilmember Delray Shelton and I have put together a group of dedicated residents to engage in this work. Their task will be to review the police policies and procedures of the Merced Police Department as it relates to the use of force in partnership with Chief Cavallero and his team. Their scope will be to better understand our use of force policies, to understand what our department is doing well, and where we can improve within the bounds of California state law. It's the first step, right? This is the part where we come together and really dig in and do some work to understand what the landscape is today, what's happening at the Merced Police Department, what they're doing well, and what can be improved upon, and have a broad set of feedback come back from our community members, and then have some findings that we can act on as policymakers at the city council level, at the police department administration level, at the city manager administration level.
We have a very, how do I say, a very good community. Nothing's perfect, but if we can make things better, yes. But the idea here is not to go through and try to rip things apart. I think we have to stay cohesive and focused and positive.
Some of my recommendations that I personally will bring to the table are community policing. I believe a police will have a better effect on the community if he actually lived in that community, right? If he knew who the knuckleheads were in the community and he knew their parents and things like that. So it allows for better engagement. Everybody's know who they are. So I think it's better. And then another thing that we're asking is mental health and calls like that. Some calls don't always need the police to show up. Some calls need like a behavior health specialist or somebody that can help these people through that. So on certain calls, instead of police showing up, maybe a mental health person or somebody that can help them with their actual situation at that time.
We're actually looking forward to it. We've been reviewing our policy for the last month or so internally. Like I said in my comments, with subject matter experts, the administrative staff, council from the city, association leadership. But the component that was missing that this satisfies is the community input. One of the things that's really clear is that our policy is available publicly, but it's sort of written in such a way that it's helpful if you're in the business to be able to interpret or understand the policy. And one of the things that's been clear to me is that if you're going to make this public, a document public, it has to be something that everyone can digest and understand, not just if you've been immersed in that industry, right? So there's some work to do there. We've heard very clearly the community's expectations that, for example, the carotid artery restraint not be used, and we prohibited that about 10 days ago, I think now, and any body positioning that restricts blood flow or the airway. So that's probably one of the major changes we made. There's a list of some pending changes that are more process oriented, but again, it clarifies the document for use by the public at large. And I think that's important.